The alimentary canal. Anybody remember what the GI tract, what kind of tissue we find in there primarily? No. Simple columnar, simple columnar. And that begins in the lower third of the esophagus. As I mentioned, stratified columnar, or stratified squamous, is in the mouth, the oropharynx, and down the upper third of the esophagus. And then it transitions into simple columnar. There are millions of goblet cells. As you can imagine, you have to keep that food mass moist, keep it wet. That helps to in the breakdown process, and also allows it to pass down through the intestines. There are four layers to the intestine. The innermost layer is called the mucosa, and it is made up of an epithelial membrane. It has multiple functions. One is in secretion. The mucosa will secrete various substances, in particular mucus, but hydrochloric acid, bicarbonate, other things will be secreted by the mucosa. It also is functions in absorption. For the foodstuffs to get into the vascular system, they have to pass through the mucosa. And the acidity, well, first in the mouth you have lysozymes, which are going to kill off bacterium. If they get past the mouth and into your stomach, then the extremely low acidity will also kill off the bacterium. If we look at the intestine, not small intestine, you can see this layer right here, this pink layer, is the mucosal layer. It is made up of epithelium. Most of it is simple columnar epithelium. It sits on a lamina propria, and then it has a layer of smooth muscle called the muscularis mucosa. And that layer is right here. That doesn't show it very well, does it? The muscularis mucosa is a longitudinal layer of smooth muscle cells, and when it is stimulated, when the bolus of food passes into the tube, it stretches the tube. That triggers a reflex which causes the muscles to contract and begin what are called peristaltic contractions. Peristalsis is the contractile process that moves the food down through the GI tract. The next layer out is called the submucosa, and it's this gray layer that you can see right here, or tannish layer. It contains the glands, lots of goblet cells, blood vessels, and nerves as well, and you can see some of the glands right over here. The glands all have ducts that enter into the lumen of the intestine to secrete their substances into the lumen. The next two layers are called the muscularis externa. It has an inner circular ring, which you can see right here, and an outer longitudinal ring, or layer, which parallels the tube. Those two layers are innervated by nerves called the enteric nervous system. And remember when we studied the nervous system, we talked about, we mentioned the ENS. The enteric nervous system is a nervous system of the GI tract. Its purpose is to bring about breaking down of the food bolus into smaller balls, as well as to move it down the tube. Once food enters into the posterior part of your throat, reflexes kick in, and it automatically passes into the esophagus. It moves down through the esophagus by contracting in back of the bolus and relaxation in front of it. I think I have some slides that show that a little later. But the muscularis externa is the main muscular component of the GI tract. And then the outer layer is called the serosa. It is covered with a serous membrane called peritoneum, for the most part, and as well as connective tissue. So the submucosa itself contains blood vessels, lymph vessels, and the submucosal nerve vessels. The muscularis externa, in all regions except for the stomach, consists of an inner circular band and an outer longitudinal layer of smooth muscle cells. And as I mentioned, these are the ones that are responsible for the movement of the food bolus all the way down through the GI tract. So peristalsis begins in the esophagus, continues all the way down to the anus. And then the serosa is the outermost layer.